right. Hello. Good afternoon. I will call the Board of Health meeting to order. All right. We can start with public comment on items under the board's jurisdiction and not on the agenda. Are there any comments for items not on the agenda? Okay. Sorry, reshuffling some stuff here. Okay. First item is discussion decision, approval for the minutes from the 16th of June.
I'll move that we approve the minutes of Monday, June 16th meeting.
Okay.
Motion a second.
Perfect. You second. You second. All right. Perfect. Thank you. Okay. There's been a motion and a second to approve the minutes from Monday, June 16th. Is there any public comment? Any public comment?
No.
Okay. Hearing none. All those in favor, please signify by saying aye.
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 All those opposed, same sign. Motion passes. Today is, we're the 15th today, right? Okay. Would you hand those? Would you set those down to Daleen, please?
Yep.
Dwight, thank you.
Thank you.
Yep.
Okay. First up in the hot seat is Megan Bullock, Broadwater County Sanitarian Environmental Health Department update.
Okay, I gave each of you a comparison list of activities that we've been doing. Unfortunately, it's like comparing apples and oranges because you can see there's a month difference in what I'm comparing it to.
Yeah.
But it's been pretty steady, issuing a fair amount of permits most recently. It seems like it's picked up a little bit. Inspections of licensed establishments, those are our restaurants, motels, trailer courts. I attached the second page because Food and Consumer Safety section of the Department of Public Health and Human Services, they audit me, and every quarter I have to send in to them my inspection reports. They review them, and so I just highlighted, they compare us to the state, so I just highlighted county. And if you go straight across, it's just showing my performance basically, and then their comments on my inspections. As of today, I think I have 12 inspections left to get done before the end of December. So very happy with the progress there. Other than that, the county fair went off without any problems. I think we had, was it 13? Maybe around 13, 16 food vendors. I did attend one of the Slice of Summers, did some inspections there, attended a DEQ contracted county meeting, and then have had a couple enforcement cases, one at the silos, and then another one that was junk vehicles and solid waste, tires, whatnot, and that one's coming into compliance. And then upcoming, we have the Fall Fest, so we've been kicking out a fair amount of temporary permits for that.
What do they pay for the temporary permits?
It depends.
Okay.
If it's a nonprofit, they pay nothing. They might also be under the cottage food or the local food choice, and it's nothing. They might be a licensed mobile, so they don't pay anything. It's only the people who don't fit any of those categories that pay $85 for a small and $115 for a large.
Okay. Do you feel like everybody's, they know who to reach out to for all the permitting, like when they come into the county, they know to contact you?
I think so.
Okay.
And most of the events have a coordinator, and I think
Okay.
they work well with Daleen, and yeah, I've been really impressed with how organized they are.
Okay.
Yeah, works
Perfect.
good.
Thank you.
Yes.
I know you need to get
Any
out of
questions?
here. So, is there any questions for Megan?
Megan, what's a test pit?
A test pit, so anytime somebody wants either a DEQ parcel that's going through review or a 20-acre parcel, there's exceptions to that, but for sake of explaining, when there's a 20-acre plus parcel, it was not subject to DEQ review. So when they come to get a septic permit, I can't issue that until we do a site evaluation.
Oh.
So they're required to dig an 8 to 10 foot deep test pit within 25 foot of where they want to put the septic.
Oh,
I go look at it, I make sure there's no limiting layers such as bedrock or groundwater. And then I also figure out what type of soil is, so I know how to size the septic system.
wow.
So that's
I
what,
learn something every
that's what
meeting.
know,
test
right?
pits
So
are.
good.
Thank you.
Yeah, so like a
Thank you.
sandy soil is a different application rate than a clay
Yeah.
soil. And then
Okay.
that helps us size with some math. We figure out the size of the drain field. Any other questions?
I don't have any. You guys have any questions? Emily, did you have any questions for Megan?
Nope, I don't.
Okay, thank you.
Okay.
Sorry, I forgot to mention Emily is the voice you were all hearing. She's
voice
attending through
memo.
Teams today. Yeah. Okay, thank you. All right, next up, Ruby Taylor, Public Health Director, Department Update.
Hello.
Hey.
So my biggest thing is I have the highly infectious disease tabletop coming up. It will be March 4th, which is a Wednesday from 9 to noon, and it's going to be in the community room at the school.
Are you running that?
Yes. Well, it's hosted by the FEP team from the state, so it's an online situation, but I'm hosting our group, essentially. So it'll be run by FEP, but I'm coordinating for Broadwater County. And so I'm working on getting invites out for that. I was going to send like a save the date last week, but now that I have an actual location, I'm just going to send out the full invite. And anyone from Board of Health would be welcome to come. I'm going to send it to the hospital. I'm going to send it to DES and see if they can forward it to the DES list. And do you guys have any other ideas of people who would be good to come? I was thinking about going over to St. Pete's and just asking if Megan maybe could take the day and come over. And see what else we can kind of do there. But
Yeah, I think anybody that we could get from DES or from Helena would be good because that's where most of our stockpile would come from.
okay.
For PPE and things.
Okay.
I agree. And Ruby, if you need any help from us too, let us know.
Oh, I know. I got you guys. You're on my radar. Don't worry.
Yeah, it's speed dial.
We'd love to help.
Yeah.
Perfect. I don't think that I have to do a whole ton other than find our plans.
Yeah.
So,
Okay, let me know.
yes,
Happy
I will
to
let you know if there's anything else I need from you guys. And then, other than that, the department is just the department. We're getting into flu season. It's going to get a little crazy. I'm going to a conference next week. It's our Summer Institute conference in September.
Yeah, right. I was like, what?
Yeah.
Okay.
They changed the dates but didn't change the name. So Summer Institute in September. So that'll be good. That's a grant requirement for me. There's a couple classes that I need to go to there. It's always a great experience. I always learn a lot, so I'm very excited. Megan is going with me because there's a couple things on mental health and like systems and stuff like that, and so that'll be good. I haven't heard anything on the trainings that we're looking into doing for mental health yet, so I'm going to check in with Megan on that too and just see where we're at. And then I think that's about it. It's about as crazy as it's getting right now. Still working on deliverables for FEP and all that sort of fun stuff. I just have to find all our plans and send a list of them, and then I have a couple more that I need to work on, so
Okay.
nothing too crazy.
If you are, are you planning on staying, or are you headed back?
I can stay.
You don't have to. I was just curious, as you're considering all these things. I know we've talked previously about Board of Health, how Board of Health can assist you.
Mhm.
Is there anything you want us to consider as we talk about?
Last time we
scope and
talked about like
strategic plan?
policy development,
Mhm.
and that'll be super helpful because I'm going to need to rewrite like our communicable disease and that sort of stuff this year. And I'm not going to be able to push it off again, I don't think, this year. And so I am probably going to need some input on that, so I'm hoping to bring that to the next meeting and just sit down and go through it and see what we need to update, change, all of that sort of jazz. And then I also will have some policies to bring in, like our emergency transport plan, which I already updated and is still good as far as I know. So we'll look at that and fill out that sheet and get it signed. And so I was hoping to bring a lot of that either to next meeting or the meeting after. So
Okay, so do you have electronic copies of those policies?
not currently,
Oh, okay.
as far as I am aware. So that's where the finding them comes into
And
place.
how long well, my thought was if you could send them, we could try and help tackle one policy at a meeting.
So like my communicable
Yeah.
disease plan is 45 pages long. And it does not need to be that. So that's where I'm at. Like I'm trying to figure out what I can pare down before I send it to you guys, because I don't think you need to be stuck with 45 pages of nonsense.
Even if you were able to make, I mean, that's a lot of copies to make, I get
Well,
it.
and it's
But-
the way that it was formatted in the server is they formatted it in like each section they wanted to do. And
Oh.
so it is an absolute nightmare to send the electronic copy and a nightmare to print it out. So I can definitely get you a copy. It's just going to take me a hot minute.
I was just thinking along the lines of us being able to contribute.
Yeah.
to the
No, and I'm
to the
happy.
policy,
I'm
right,
happy to
or-
bring it to you guys.
If you, do you need help condensing it first, or is that something you're trying to tackle on your own?
It would be nice to have help condensing it because I don't have the strongest ICS background, so having someone else who can look at that with me is super helpful.
Okay, and do you think that's something that could be done like a chunk at a time with each meeting, or is it something we need to like spend a full meeting on, or what are your thoughts?
I would prefer if we did it all in one go, just so that it didn't get like put on the back burner in multiple
Sure,
sessions.
sure.
So either like an entire regular meeting or like a special working meeting or something like that we could do. That would be ideal, I feel like.
Why don't we put this on the next agenda, and then if you can get us copies, that's going to be really key. You
Yeah.
might have to like deliver them to everybody, but we're all
I
close
can,
by.
I can teach you how to digitalize them straight from a paper copy if you have them.
And I do have it. It's just, and I have the, like for my CD plan, I definitely have that one in my computer.
Okay.
I just have to figure out how to, I probably would have to send you guys a zip file to get it to you.
Okay.
So I just need to look at that and figure out what the easiest way to do that is.
Or I don't know if does everybody have Microsoft Office? We could do a shared.
Oh, okay.
You know what I mean? You just keep it hosted on Microsoft Office and do a share, and then we can print what we want, or people could read it online as
Yeah.
well. I guess my ask for you would be, and you guys please jump in at any time, Emily, please jump in. My ask would be to kind of know specifically what you want. Like, this needs to be reduced. Here's the spots that I think would be good, to cut out, or kind of what your goal is for the document. So then we can kind of have those items looked at and ready to go for you.
Okay. So next meeting, do you want me to have like the CD plan ready for you, or I also have to have my influenza, which a lot of people do those two together. So I might send you both of those so we can do CD, influenza, and then I have my transport plan, and I feel like there's one more that I'm missing.
Your influenza, that's a separate policy than your communicable diseases.
It's pan flu,
Okay.
and so a lot of the times, other counties that I've looked at their plans, they will annex the flu plan in their CD plan or vice versa. And then I have one from like Granite County, I think, that they just put it all together. So it was just their flu and communicable disease plan.
Okay, so, I mean, right now we're meeting every other month. I mean, it might be just something we have to meet monthly and just kind of bite off things in a little bit smaller chunk for a while.
Yeah.
But in anything, meetings that go well over an hour get pretty cumbersome. So
Yes.
if we have to, eat the elephant one bite at a time,
Yes.
a little bit smaller, that's okay too. But it'll help to have you, with a kind of an agenda of what you want to get
Yeah.
done on that.
I can totally do that.
Do you have Microsoft?
Yeah.
Or you're good, and then I'm JJ, but I mean, just so he has access to, if he can access, I'm not sure if he does, but that might be a way to just share that document.
Yeah.
And people can print as they want to as well.
Yeah.
Ruby, when was the last time we did a policy review?
2021 was the last time it was.
It's been about 6 years. I
Yeah,
think,
it was either 2019. It was somewhere in the pandemic.
Yeah. Okay.
So it was either like 2019 or 2021, somewhere in there.
Yeah,
okay. I think the most recent one has a 2021 date on it though. And I don't know if it was just like public health reviewed it and brought it to you guys to look at, or if it was like went by piece and got this like how we want it to be. So, and part of it I think was done by DES too. And that was
Okay.
it's maybe sooner than 2020 because I think Mike Conkey was on that. His name is on that plan.
Sooner, like more recent than 2020?
No, like
or
later.
previous, yeah.
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 So yeah, it's
That's
just
correct. I
it's-
remember Mike being on that.
yeah, it's a lot to look at and it's just been very overwhelming for me. So it's like it's a usable plan, but we definitely could improve it. So now that I'm feeling a little bit more confident on that stuff, I am happy to look into it more and to like work on it this year. But the last couple of years, it's like the most daunting task on my list.
Yeah.
Is there a regulation that states how often you have to go over it?
Not necessarily. I think, well, for FEP, we are supposed to look at it yearly and just make sure everyone has read it and looks at it, which we did last year. It was kind of rushed because I was gonna get it updated and just didn't get a chance. And so I sent it to you guys to look at, but I don't think I don't think any of us went through it super well.
Mm-mm.
So just getting into it better this year will be.
Okay.
Would you please send me what you want to have on the agenda and like how you want to address that, and then yeah, kind of what we're going to bite off like in one meeting.
Okay. Then I think that's all the crazy stuff I got going on.
Just the
Ruby,
crazy.
And I'm happy to help with anything you need to from an IP end of it. So just reach out. We definitely, if we need to get it work, you know what I mean? However I can help, let me know.
Yes. I will definitely reach out if I need extra, but I think just having all of you guys like hive mind it with me will be super helpful.
Okay.
Ooh.
Yes.
The HS
Come up
training-
to the thing. Just I'm sorry, just so
Oh,
the
okay.
recording has it.
The HS training through DPHHS is one of the deliverables for environmental health.
Yes.
They canceled the August-September sessions,
Okay.
but I'm on to do it in October.
Awesome.
I think it's October 7th and 9th. My next thing is, am I supposed to take part in the tabletop?
If you want to.
Is it required?
It would be super helpful for you to be there because I don't know because one year we did a foodborne illness and so that would have been super nice to have you there. But that was bad planning on my part too. But this year I don't know what the scenario is going to be. Okay. So it would be nice to have you there. If you're there for the first hour and you're like, this has nothing to do with me, you can absolutely peace out.
Do you know, are there any other deliverables from environmental health other than the training?
The only one that I know of is your participation in the DES meetings, the LEPC. Mhm.
Okay. And then truck wreck protocol
Yes.
usually just needs looked at.
Yep.
Right?
Yep,
Okay.
and I can send that one to you. And we maybe should look at that one all together too, because it's been a while since it's been updated too.
Okay.
Thank you. Thank you.
Madam Chair,
Yes.
I might suggest that since we have some new board members on this board and it's been a while since we've looked at the policy, that we set aside a I know everybody's meeting to death, but
That's- that's what it
to
is.
go over the policy a little bit
Mhm.
finer so that next year we can, it won't take as much, but maybe
Yeah.
just to go into it a little bit in depth this time
Yeah.
because the new board members might have some suggestions, some easier things to do, or just some, I don't know.
Do we want,
That's
well,
just my suggestion.
so I had November as our next meeting date, just because we were going every other month. Do we want to do a working meeting just to focus on the stuff, and then we could bring whatever comes out of the working meeting to the November meeting to kind of finalize?
Finally, I think
That'd be
that'd be
good.
great.
Okay. October would be it.
So I've got my conference next week,
Uh-huh.
which I can probably steal some time away to like look through my files. But then the second week in October, I'm gone. Also,
October's kind of crazy. Because it's going to be Christmas, we're going to blink, and it's going to
gonna
be
be
December.
over.
It's flying that fast. That's fine. I mean, this is our next meeting date would be November 17th.
Mhm.
So, would something like the week of October 20th work?
Perfect.
Well, let me triple check.
Okay.
Am I the only one with paper calendar?
I have to have it.
I've tried to do the paper calendar, but I cannot be trusted.
yeah.
Finally gave up.
I have to have it all in one place on my phone. That's with me all the time, so it's terrible. And then it crosses to my computer. So if I'm, if I don't have my phone, I can look on the computer, but I would lose track.
As long as it's not that Friday,
Would would a Monday work at our normal time?
it should. Yeah.
Okay. Yeah, 3 p.m. Why don't we shoot for that? Emily, will that work for you? Monday the 20th?
I should be able to make that work, yeah.
Okay, I'm just gonna say Board of Health working meeting. Okay. And we'll just say, public health policies.
Mhm.
Or public health policy review. Okay, 3 p.m. And then hopefully JJ can
Yeah.
meet, and if there's an issue or he needs to reschedule, or we find out
Yeah.
if there's a better time or later or something, then we'll go for that. Okay. So. October 20th. So just if you can get that information out to us.
Yes.
Somehow.
I will
Either a shared
drive or
document.
something, or-
Yeah, I mean, like a Microsoft, everything on like your main page of Microsoft or your OneDrive or whatever
Yeah.
you can share.
I will figure it out and get it to you. It's
Perfect.
I think it's fun.
Awesome. Thank you.
You're welcome.
Thank you, thank
It's
you.
like a scavenger hunt in my hard drive.
Right.
Create a OneNote. It'll change
Yeah.
your life.
I know. It helps.
I'll
All
do
right.
that.
Okay, so next thing up, I've been talking with Daleen. We're kind of trying to get ahead of the curve with boards, period, because what seems to happen every year is that people's terms expire, and by the time everyone gets a letter turned in and we advertise it for 30 days and all that, all of a sudden it's January and you're starting the new year without a full board, and the older board members are kind of stuck depending on if they have reapplied to still be on the board or extend their terms. So I think we wanted to get ahead of that a little bit this year. So I know we I have my letter. Here we are. So Dwight, you and JJ both have expiring terms
Okay.
this year. And I don't remember, Daleen might have it, like how long your terms were.
I think they're 3 years.
They're both 3 years?
I think.
Okay.
Not 100%.
Okay. So you will have to, if you want to stay on Board of Health, you'll have to resubmit a letter of interest. And we will advertise that. When did we decide we're going to advertise that for? Because we wanted to be able to discuss it and appoint, or have recommendations for the commission at the November meeting, and then we would have everything set up to go starting January.
So we would need to advertise October, right? October.
Yeah, for at least we could advertise.
meeting.
Yeah, if you once we hear from JJ, we could probably advertise.
Okay.
So.
Do we have an open slot now too?
Well, okay, so that was the next thing. Technically, I'm the 5th member, but I'm not really supposed to be for MCA, and I'm probably really not supposed to be the chair. So, I am technically, we're supposed to have, MCA says 3 commissioners and 2 appointees, or just 5 appointees. So I would stay on as a commission liaison like I am with other boards, like all the commissioners are with boards, but it would be ideal to get a 3rd person. So I think we would have technically 3 open slots. And I have found that when we can ask people, go to people specifically, that seems to work better than just advertising in general. You never know. We definitely get some interest that way, but even asking some people. So I think, you guys, I don't know what JJ's intentions are, but or yours actually. You don't have to answer right now either. But I think we would need to know. Not necessarily need to know, but we'll need to advertise, and then once that position is open for 30 days, within that you just have to turn your letters in, and then we will review and hopefully appoint somebody in November.
Yeah.
Okay. So looking for a 3rd person. So if you know somebody who is interested in being on the Board of Health, that'd be great. Okay. All right. I'm looking at you. I'm putting pressure on you.
I'm thinking, who else?
Oh, come up to the. Thank you.
Do we just advertise it in the paper typically?
Paper website, right?
Paper, website, I think that's it.
What if we brought the advertisements to like the clinics in town, like one to St. Pete's and one to Billings Clinic, and make sure that their providers or nurses or whoever get a hold of it and can read it?
Yeah,
And-
I would think you guys could probably let Billings Clinic folks know, because we've got 2 Billings Clinic representatives.
And so I'll run one. I can run one to St. Pete's when it's out and make sure that they see it. And
see if somebody's interested. Are any of their providers living local?
Megan is the provider out there. It's Megan Watney.
Oh, okay. She lives locally.
Oh yeah,
Okay.
she's a Watson.
Oh, okay. Oh, yeah. Okay, that's
Yeah.
right.
So
Forgot.
she's super local.
Yes. Okay. Yes, that would be great. Like, have representation there. I think it helps to have representation on the environmental health side of things, which JJ does. And so I think that's helpful too. So,
Yeah. If there's any other
because
people in the community, like I don't know if people look at the website or the
I know
paper
it's hit
as
hit
often
and
as you
miss.
think. So
No, it's hit and miss.
maybe I could share it on our Facebook page too.
Yeah,
So-
that's
Idea.
yeah. Any of that, I'll put it on my personal page. But I mean,
If we make a
Yeah.
flyer, we can post it within the hospital too, so community members can find by.
Perfect.
Interest.
this Board of Health needs another member. Yeah.
Yeah.
And then we would need Daleen, in order to have it on. If that, and we're jumping ahead a little bit for our next meeting on the 17th, in order to be able to decide on that, we would just need to have it open like 30 days, at least 30 days. So they'd have to have it in the week before our meeting, so everybody could read. That really,
Yes, that's cutting it pretty close.
yeah, we could be earlier. We could be earlier than that.
I think if we, personally, I feel if we opened it October 1st, right?
October 1st, sure.
Then we go October 1st to November 1st,
Mhm.
then we
Yeah.
can for surely have those letters of interest in, right?
Yeah, but I mean,
And send them
yeah.
out to the,
Yeah, I mean, there's not a whole lot we can do to, we can review them a little ahead of time, but I mean, if someone, I think we should close it for sure.
mhm.
I mean, maybe say through the 7th or something. That gives everybody time.
Yeah.
Okay. I think that's good. Let's open.
Lindsay, I need to go.
Okay,
Um,
you're fine.
But.
Oh,
should I just-
no.
I'll just leave it on. I'll just kind of keep an eye on it and.
Oh, just leave it on. Yeah, that
I'll
would
just
be
leave it
great.
on.
Can you leave that? She's running the teams because she was the invite, so that's the problem.
Mm-hmm.
Okay,
Well, it should stay open as long as Emily's in there.
yeah, you should be able
Okay.
to go
Well, that's
off
what
of
I
it.
didn't want to,
Yeah.
I haven't had a chance that, so go
No.
ahead, should I go ahead and shut mine off and
Yep.
see?
Yep, it'll.
Emily, if it cuts you off for some reason, call my phone and I'll put you on speakerphone.
Okay. that's
Okay.
great.
Okay,
Okay.
thank you.
Yep.
Have fun.
I know.
Thank you. All right, guys. Thanks, Daleen.
Mm-hmm.
Okay, next up, discussion decision, Board of Health scope and strategic planning. I sent out a handout. Thanks, Megan.
Yes.
Take care.
See you, mate.
I sent out this handout, just tried to kind of summarize what JJ had sent in his previous emails, what I had sent, and just kind of looking at what we had talked about also in our working meeting. Step all over here. So mission statements, there's several of them that we had as ideas. I pulled some from different places. I'm not sure JJ got where he got his from, but what are your thoughts on mission statements?
From what I had read, I liked your number one because I think it was short and included everything.
Okay. I tried to pull from the different ones and combine everything
Yeah.
on that.
Yeah, I thought that was great.
Dwight, did you have any thoughts on them?
The one, well, yeah. I thought I had a really nice one until I saw JJ's and JJ's. So, yeah. Yeah, I like them all, actually.
They all
I
kind
think
of, they're all saying like basically
Yeah.
the same thing,
Yeah.
but slight bit different.
I felt like JJ's was a little bit longer, like it fit more into like the scope,
Right.
you know.
Were these all supposed to be separate? I think they're all supposed to be separate, right? Or was this all one thing?
I thought it was all one mission statement, but I could be wrong.
I don't know. Okay. I'm just reading it wrong. No, I think, okay, so he had
Oh,
said
is
in
it
his email
separate?
several possible mission statements. So yeah, he had,
That's how I took it. is
yeah,
that, right,
different,
yeah.
they're each different.
I like number one.
On
They're
JJ's?
all good.
Or
They're
which one?
good.
On JJ's?
Yeah, they're all good though.
Saves. To preserve and protect Broadwater County residents' safety and well-being while ensuring their ability to recreate and live in a healthy environment. Emily, do you have any thoughts on it? Oh, uh-oh.
That's tough. I like both of them. Can you guys hear me okay?
Yeah.
Yep, yep,
gotcha.
thank you, sorry.
No, that's okay.
We're all thinking.
Yeah, we're all,
No, you're peaceful.
We're deep in thought.
What if
And
we
you're right,
kind of
this-
combine them both?
Yeah, let's combine them. What's that?
No, you're right, though, a scope too is different than a mission statement.
Mm-hmm. Mission statements, you're like,
A little
you're
short.
quick, like
Yeah.
15-second, what's Broadwater County Health's
Yeah.
purpose? Well, here's, or health, excuse me, Board of Health's purpose.
We could add, promote, and protect public health and environmental qualities. I do like how he talks about safety and well-being, like we could
Yeah.
try and get that in there.
Why don't we just add that? To promote and protect public health and environmental quality in Broadwater County through education, community collaboration, policy.
Yeah, the one you have,
Safety.
Lindsay, is very good too.
What if you do to promote and protect safety and well-being through public health and environmental quality?
Yes, I like
There
it.
we go.
That was
I
good.
like that.
Perfect. Ruby, good job. Okay. So to promote and protect public health, right? To promote and protect,
Promote
safety and well-being.
Through public health and environmental quality in Broadwater County.
Through public health and environmental quality.
And maybe the
Broadwater
second
County.
through can be changed to with education, community partnerships, collaboration, and
Yes,
policies.
Perfect. Safety and well-being through public health and environmental quality.
I like it. Sounds good.
Being in Broadwater County, right? We'll say that
Through
first.
Yeah.
And BCO through health and environment with public health and environmental quality.
So to promote Broadwater County.
So to promote and protect safety and well-being in Broadwater County through public health and environmental quality. And I think we could even just say educate, you're saying with education, community partnerships, collaboration, and policies.
Mm-hmm.
Education, community partnerships, collaboration, and policies. I like that. I mean, does that
Yeah.
work? Yeah. Okay. Right.
Kind of covers everything.
So to promote and protect safety and well-being in Broadwater County through public health. Oh, sorry, did I say that right? To promote and protect
Safety and well-being in Broadwater County through public health and environmental quality with education, community partnerships, collaboration, and policies.
Why don't we just say to promote and protect safety, comma, well-being, comma, public health and environmental quality in Broadwater County through education, community,
Sure.
blah, 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 blah.
Mm-hmm. That would work.
That would work too. That was a lot of ands. I think that's where we're
Yeah,
struggling.
that was struggling. And protect public health, safety, comma, well-being, public health, environmental quality. Okay. Okay. All right, so we'll get that finalized. Sound good, Emily?
Yeah, that sounds great.
Okay. All right. Thank y'all. All right, if you go to page 2, talking about the scope. I guess, well, let me back up really quick. Do we want to do an official decision on that? So I guess we'll just do a motion there, please. I'll need a motion to adopt that as our mission statement, and then it'll need to be read, please.
Okay, I'll make a motion to, for this mission statement for Broadwater County. The mission statement being to promote and protect the safety and well-being in Broadwater County through education, community partnership, collaboration, and policies.
Are we not adding public health and environmental quality?
Oh, you're right.
Sorry.
Strike that.
Sorry.
To-
I know it's hard to see
I was
once you
trying
start
to
writing on
write
it.
it really fast, so I got it right. Promote and protect the safety and well-being in Broadwater County.
Safety, well-being, public health, and environmental quality in Broadwater County. Protect safety.
I'll second that.
I love it. Okay, where did you want public health put back in there? After protect?
So I think it's to promote and protect safety, comma, well-being, comma, public health, comma, and environmental quality in Broadwater County through education, community partnerships, collaboration, and policies.
Just
It's a lot. It's a lot. I mean, you could, to just put a pause on motion real quick. Well, you seconded it, so technically we're all about discussing right now. So, yeah, we could, instead of a mouthful, what's overlapping? I mean, safety, well-being, public health, environmental quality. How about just to promote and protect environmental quality, public health and well-being? Does safety need to be in there?
I feel like when we started talking about,
I think you're right. We got the word protect, which is safety. And
yeah,
want to trim that out of there.
So to promote and protect public health, well-being, and environmental quality.
Take safety out.
Or is well-being assumed in public health?
it's kind of assumed.
That's just my question as I'm rewriting my notes.
How about we go right back to your original statement?
It's fine. I mean, I think it's encompassing. It's encompassing what needs encompassed, I guess. Unless you want to add, you could add safety into that to promote and protect public health and safety, environmental quality, or public health, safety, and environmental quality. And just leave out well-being, because it's kind of implied with public health, right? Protecting public health.
So to promote.
So to promote and protect public health, comma, safety, comma, and environmental quality.
I think
in Broadwater
Dwight's right,
County.
though, that the protect implies safety.
Oh. So then just
I think just
leave
the
it.
way you had it is perfect,
Okay,
too.
just
Yeah.
leave it here.
I think we wanted to Frankenstein so that JJ didn't think that he was
Yeah.
missing out, but
I think
you
we're all
said the
saying-
same thing.
We're all kind of saying the same thing
Yes.
in different ways.
Yes.
Everyone's covering the same points. It's not really like original work here. Okay, so we'll just leave the original.
The only thing that is missing from that is recreate versus JJ's and yours.
But what are we protecting in recreation as the Board of Health?
Environmental quality would be part of recreate, but also I don't know if you need to state that anywhere.
It kind of goes without being said, I think,
Yeah.
maybe.
Correct.
Yeah, that's your well-being, that's your environmental quality and your health.
Well, and there's a whole board for recreation, so
Exactly.
we should be good.
That's fine. What do you think, Dwight?
Yeah, I don't think we have to have recreate in there, but
Emily,
I
any
think it
thoughts?
sounds great.
She's like, it's good, guys, it's good.
She's like, you guys are overthinking it. All right.
Okay.
So let's
I
make,
just
do
come
I
back.
need to make another motion to accept yours then, since we had discussion
Sure.
and we went back?
Yep.
Okay. I'll make a motion to accept Lindsay's option 1 as our mission statement for Broadwater County Board of Health.
You have to read it.
Oh. To promote and protect public health and environmental quality in Broadwater County through education, community partnerships, collaboration, and policies.
I'll second that. Oh, okay. Good.
So motion
Thank you,
was
Lindsay.
Tiffany, and second, we had a double whammy.
Oh, she can have it.
Emily. You guys are gonna rock, paper, scissors for a second. Okay, there's been a motion and a second to adopt mission statement saying to promote and protect public health and environmental quality in Broadwater County through education, community partnerships, collaboration, and policies. Is there any public comment? Any public comment? Hearing none, all those in favor, please signify by saying aye. Aye.
Aye.
All those opposed, same sign. Motion passes. All right. Popping over to the scope. So this list came up in our working meeting. We're just trying to discuss, the scope of the board. I highlighted the main, there's 8 of them. There's 8 main areas. And looking at those, I mean, this came up in our working meeting. We put these together. Do you see areas? So I see the scope is like, here's our scope, and then the plan is more specific within the scope, right? And the strategic plan supports the scope of the board. So to make it fit for our board, our area, do we like these 8 broader categories as our scope?
I feel that the health services oversight and public health policy development are kind of redundant.
Okay.
So I would keep public health policy development and maybe add, or maybe not maybe add, but maybe take away what needs done regularly and put like an oversight of programs and services offered within public health.
Okay, so say what again? Ruby, put
Oversight of programs and services offered within public health.
is it oversight or is it input into? Because we're not really, the board isn't.
Yeah, I
really
would say
overseeing it.
input.
Okay,
Or maybe suggestions or input. I don't know which one sounds better there.
Collaboration? with
Yes.
public health?
Yeah,
Mhm,
collaboration
yeah.
with public health on programs and services offered. Or just programs and
so
services.
collaboration with public health services. On services?
Programs and services.
Okay. Programs and services.
You could put offered at the end of that.
Services offered, okay.
Hmm.
Sorry, my stomach is growling really loudly. Don't mind me.
And then just take number 5 completely off is what I would
Yep.
say.
Okay,
Yeah, I'm okay with
perfect.
that.
I can do that. What do you think, Dwight?
Yeah, that's fine.
Emily, good with that?
Yeah, that sounds great.
I noticed this too as I was rereading it again, just same as you're pointing out, Ruby, there's some redundancies. When we say emergency plan review, do we want, I mean, we don't have to get too in-depth with these ones, but emergency plan review, that's what we're talking about is,
Yes, I would leave that pretty broad because the emergency plans could change.
should we say emergency plan and policy?
Yes.
Review. Okay. Okay.
Or maybe emergency planning and review, because that would imply that we're planning, then we're reviewing our plans.
Okay.
Because it's not necessarily policy either.
So emergency planning and policies review. Okay. All right. There was another one that I thought was a little redundant too.
I think the community engagement and the health education and promotion are kind of,
Yes.
Yeah, and I think
you
we got
could,
detailed on like how we would do health education
Mm-hmm.
with the A through G.
Mhm.
Those could probably go into the planning that would support what we're doing versus having it in all the things. Like the wildfire, clean air, clean water, seasonal safety, those things could probably come out and go in the plan part versus in the scope.
Oh, in the strategic plan.
yeah.
Yeah, absolutely.
And then I would just take the bullets from community engagement and move those up there.
So these move up to health education and promotion, and these, so like B through G would go in strategic plan?
Yes.
Okay, so underneath number 2, we would have the community engagement. So we already have engagement programs, educate the public, blah, 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 blah. Community engagement, and that could just be a bullet point within itself under there. Community engagement, right? We could just move that whole thing.
Essentially. And you don't even have to put the community
No.
engagement. You could just put encouraging community involvement after. So engage in programs that educate the public about health risks, prevention strategies, and healthy lifestyle choices. And then B would be encouraging community involvement and feedback in health planning and decision-making process.
Okay.
And then I wouldn't put like essential for addressing a specific need. I would just put that they're involved in the process.
Okay.
And then those community, I don't think you would need to do work with school or community partners.
Okay, just take that out.
Because you could put that, you could do encouraging community members and partners or something like that if you wanted to get more specific in that previous bullet.
I think it's okay.
Yeah.
Yeah, I like it. I like that it's broad because the more specific you get on this stuff, it
And
the
we
more you
took-
have to change it.
We took some of these from something, I forget what we, as we talked about stuff, so that's why these aren't really in our words, that, you know, they seem more broad. Is
Which
essential for addressing the specific needs, like that's.
Yeah, and it's more reasonable for it to be broader,
Agreed.
because then you don't have to change it every year.
So encouraging community involvement and feedback in health planning and decision-making process. Right?
Yes.
Just leave it there, okay. Okay, all right.
And I think number 4, we could just stick with the A bullet because it talks about sanitation already in A.
Yep.
What's MCA?
Montana Code
Code
annotated.
Thanks.
Should that be spelled out?
It should be spelled out.
Yeah,
Yeah.
but does it need to be in the, does it need to even be in the scope? Or should it be?
I
that's
wouldn't
fine.
say so because it's implied that you're going to follow MCA
Mm-hmm.
and like FDA recommendations or federal recommendations too. So like,
Yeah, it's not like you're stating the obvious.
yes.
And at the top, we put already in public health policy development will be with state and federal health regulations, and I think that would
Mm-hmm.
fall in there.
Yeah.
If you wanted to add the MCA, you could put board oversees regulation related to sanitation as directed by MCA.
Yeah,
But other than that, I don't think it necessarily needs to be there.
I don't think it needs to be there at all.
Yeah.
I think it's it's a statement, stating the obvious. Okay, so we're down to 7, which is now going to be 1, 2, 3, 4, 5, right?
Mm-hmm.
And data collection and research.
And the chip and the chalk could probably come off because that'll be part of the actual plan.
Mm-hmm.
We
Exactly.
can get down to just one bullet point under each will be.
And we could honestly,
I don't want to say often collects. This was again taken from some stuff. So the board collects and analyzes health data.
we could combine disease prevention and control with that too.
Yeah.
So disease prevention and control through data collection.
Yes, I was just going to say, let's add a B. Let's add a B bullet
Mm-hmm.
and just put data collection or analyzing or
Reviews.
reviewing. Yeah,
Mm-hmm.
reviewing. That's a much better word.
Yeah.
What do you think, Dwight?
Well, I'm just thinking the board may collect instead of, I thought I had that off, sorry.
Well, and
I don't want to imply that we're going to be, somebody would say that you guys aren't collecting.
No.
well, and the
no.
board doesn't collect
We
data.
don't
Yeah.
collect data.
It would
so,
be through other agencies
Yeah.
that the board receives
so we
data.
would just be reviewing data.
yeah.
That's what I
Yeah.
think. Reviewing
Reviewing, that's a better word.
health data,
Yeah.
right?
Mm-hmm.
So I did-
Community health data, maybe.
Yeah.
I think you could just take the second half of the sentence on the A on 7.
Yeah.
And put it up under reviews.
To identify trends, assess community health
Yeah.
needs, blah blah blah,
Yep, blah, blah, blah.
and blah 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 blah. Okay,
I
so
can
I'm
only
just.
imagine what the notes for this meeting look like online.
You feel like what?
Oh, the recording notes. Oh, yeah, that too.
There's that. And then we have emergency preparedness, but I think that can almost fall up with, what do we say? We're
Policy development.
Yeah.
Well, an emergency plan review, that's where that would fall in.
Yeah,
Yeah.
yeah, one. A.
The only thing that we could maybe add up there is public health policy and development. We could add something about DES being in there
Yep.
because truly DES should come to these meetings.
Yep.
Yeah.
Yeah.
So,
We'll just say work with DES, right?
play a critical role in preparing and responding to public health emergencies such as natural disasters. So what I would do is take off A on underneath public health and development, policy and development, and put the A from emergency preparedness and do play a critical role in preparing for and responding to public health emergencies such as natural disasters, or public health and DES or something, the board and partners or something like that.
Collaborate with. So, I feel like we could have 3 there.
Mm-hmm.
Well, actually, okay, right now we have 3 under public health policy development.
Mm-hmm.
We have emergency planning and policies review, right?
Mm-hmm.
You could have after that the A from emergency preparedness,
Mm-hmm.
right?
It's not
Or you could
really
combine the two.
policy development because The emergency preparedness, I would argue that would need to be separate, because if there was an emergency, yes, we'd already have the policies in place, but we would be leading the county, and the public health would be separate.
So you're saying leave 8
I
as
almost
8?
think, yeah, or 7 or whatever the number would be.
Yeah, yeah.
Because, don't you think?
Yeah, I
Because
can
it's
see
not
where
a
you're coming
policy.
from.
So like.
It's actually activation of policy, like of
what-
plans.
Yeah, what if our water system backed up and the sewer got
Yeah.
contaminated?
So maybe,
That's separate than policy, that's how are we gonna handle it as a county?
maybe like oversee and,
Overseeing preparation and response to health emergencies.
not necessarily that, like, because this is, I get what you're saying. It's the emergency preparedness should be more about the response.
Yeah, or maybe it's not preparedness, just emergency
Response?
response,
Or emergency role in emergencies?
something. And yeah, I agree. It may be preparedness.
Because,
isn't the right-
like, with COVID, public health, not public health, but Board of Health, basically had final say in all the policies, like masking and all of that. So how would we word that? Like,
I mean, that's-
oversight on.
What about just emergency and disaster management?
Just,
Perfect.
I would, yeah. Should we specify health?
Emergency
health
and disaster
emergency.
management related to health or natural disasters, or like something like that.
Disaster
Or
management related to,
health or
Well, this is just a title, so we can
Yeah.
go
Yeah.
down underneath it. So just go emergency disaster management, and then we'll go deeper underneath it there.
okay, so
maybe?
then underneath it, so it stays separate underneath it. What were you going to say, Dwight? I'm sorry.
No, it's fine, yes.
Okay. So emergency and disaster management is the title, right? And then
Yeah.
we go, like oversee public health emergencies, right?
and
Oversee the response. Oversee response too?
oversee response to emergencies involving public health and
And pandemics?
not necessarily pandemic, because pandemic would be under public health. Is
Yeah, I
what
was going to say, I think you
Why don't we
just
go
say,
oversee
public
Health
health
and natural
emergencies.
disasters.
Done.
And not limited by,
But maybe
Do we even need to say that in a scope? I feel like you could get more in depth on your plan, right?
I'm thinking of where you would put in DES. So like
Well, just
overseeing-
add B. Just leave B. Collaborate
would-
with DES.
But because you would be working with DES and public health in most situations.
Yeah. So why don't we
So-
just say on B?
Or
Just-
work with public health and DES in response to public
I
health
see.
emergencies and disasters? Or something like that?
Yeah. Oversee response to public health emergencies, and then say. Yeah, I think that's easy to say. So I think in just one thing, you say work with, what did you say, public health department and
Public health and DES
to oversee in response.
in response,
In response.
oversee public health and DES in response to emergencies or public health emergencies or natural disasters.
I kind of want to just say collaborate with.
Collaborate is fine too. Oversee or collaborate.
Yeah, collaborate with public health and DES.
Mhm.
To oversee
oversee.
response to public health emergencies.
Perfect. And the natural disaster part would need to be in there because DES doesn't necessarily do.
the public health.
The public health
natural
half.
disasters.
Or you could split it into one for public health and one for DES and have basically the same statement, but one's public health specific and one's DES specific.
I think we.
I think we should.
I think
all
putting
fine.
them together makes more sense, but
Yeah, with pub health and DES to. Okay. What do you think, Dwight? What you got?
I liked the way it was, but it's fine.
What did you like? You liked.
I think it says the same thing in way, but it's fine. It's
I understand the preparing for, because we're
Yeah.
doing the preparing in the policy
Yeah.
making
Yeah.
end of it.
yeah,
which is up at number 1. And I mean, we can put these in any order. We really won't do. That's fine too.
Oh, I think it's fine either way.
Okay. And then when we get into strategic plan, we can get a little more in depth with what
Yes.
that looks like, right? Like that's, and then it's laid out and the document's there, and it kind of gives some direction and some guidelines, and future boards can change it as needed.
Perfect.
But then at least that's something there.
So that's really gonna take us down to 5, right? So we will
Yeah,
have number
6,
1,
I thought.
number 2, well, data collect, so health oversight was removed.
Just
Number
go down.
6
Just go down the list from the top. 1 is public health.
Yep.
Policy
One is public
development.
health,
Yep. Go ahead.
2, health education and promotion, with lots of corrections. 3, disease prevention and control. 4, environmental health. And then I had a striking 5, striking 6 and moving A up to 2, and striking 7 and moving A up to 3, and then 8 would then become number 5.
Yes.
I had 5. I just made 5. Data collection and research became number 5.
Oh, I thought we put that up under.
Oh, we did. We did move it, didn't we? Yeah, you're right. We moved it up to 3.
We moved the
My bad.
section here, right?
Yep.
This
Yep.
part.
Yep. My arrows were
You're
literally getting. Are you following, Dwight?
I'm trying, but it's-
Don't look
I'll
at
share-
this.
I'll share
This
my
is a
chicken
mess.
scratch with you.
Yeah.
You've got it.
We've got 1. We've got 2. What was in 6 moved up to here.
But, yeah.
And this comes out and goes to the strategic plan, right? We have 3, but 3 now includes what number 7 was.
Yep.
And then 4 we have, and then 5 is 8. Not confusing at all. Clear as mud.
It's totally fine.
Okay. Okay. Are you following, Emily? You good?
Yep,
Okay.
totally, yep.
Good job, because maybe it helps to not have the visuals of all our lines drawn all over. Okay, so we have, excuse me, I'm totally going to yawn, pardon me. Blah.
We have a mission statement and
We have a mission
Mission.
mission statement and a scope. Strategic plan, we know will support scope. We had talked about a goal of February previously. That's what I had in my notes, and I took that off of here since we're kind of a little bit behind what we were, because we just kind of got delayed a month or 2, but that's okay. Data from the CHIP and CHA can support the plan, and I was thinking if we just took one section, like for the next scope.
The CHA for sure, and I haven't
do have
started
that.
the CHIP.
yeah, that's
Okay.
what I thought. I thought we were waiting on the chip
Okay.
to start. the
So we're
plan
waiting on the
part of
chip.
it.
So what we can do, my
Well,
thought,
our plan could influence my CHIP too, because the CHIP is the Community Health Improvement Plan. So our strategic plan could influence my CHIP too.
okay, yeah. I think, let's see. So why don't we take one section of the scope, if we know that those were our 5, we've got 5 things, 5 items that outline our scope. We can start with the first one and say, okay, what do we want to, let's discuss that at the next meeting. We could take 1 each meeting or 2. What would be the goal? I guess, what do we want the plan to look like? Like what do we want, how detailed, what do we want the goal to be as we take each one of these 5 items?
I think the important part of the scope in the strategic plan is for the community and us to have an outline of how we would handle an issue, right?
Okay.
Like this is going to be our playbook. Like your strategic plan is your playbook. Sports analogies.
Yep, I got you. So plan will be the detail. But what do you see? I mean, do you see a page for each one of these 5 items? Do you see bullet points? Do you see like how specific, how detailed? And you'll know this more than I will because you get to look at these things all day long.
I know, right? So it's the how. So like, how are we going to do it? What are we going to do? So it's kind of all the meat and potatoes that goes underneath of this. So I think you can have some bullet points, but you should probably have, like for public health, we should have the emergency plans. Like, what emergency plans are we overviewing? Which ones are we responsible for? What are we looking at?
What policies would you guys be
policies are we reviewing? What do they need to detail? What is our amount of oversight for those? So the first one's going to be really regulatory heavy, probably, and we need the list of all the policies we're overseeing.
Yeah,
So
I
that's
can
a
get
lot.
that for you.
We'll probably need to work with DES too to see what they have, if there's anything,
Yeah.
because I mean, yeah,
Yeah.
because those should be listed out, because that's what we're supporting, and that gives a plan for any future Board of Health if we fall off the planet, to know.
Okay. Do we want to, what I'm thinking is I can take this back, kind of revise the scope document. We could have the scope document, and then we can, starting November, we could say, let's start with public health policy development scope item, and everybody come with items to bring for that. And when I say items to bring, I don't necessarily know. Like, that's.
I mean,
guys
essentially,
can-
it would be like me bringing all my policies that that Board of Health needs to look at with me, or needs to be part of, and probably going over the MCA that we have for Board of Health and what they do with public health.
Okay, so for the November 17th meeting, you'll need to have that ready, but that might be helpful. I mean, I think it might be good to start with this one, since we're already going to be doing a working meeting to look at
My other
the
policies.
other policies. We can start there. We could even maybe discuss this at the working meeting a bit, and how that fits in, and then we will have this item. Do we want to bite off 2 per meeting, or just 1?
I think
on
that
top of
one's
our-
going to be a lot.
This one's going to be a lot.
Okay,
So I think 1 to start with, and then the other ones are probably going to be smaller.
okay.
So we can maybe increase as we go.
And some stuff is probably going to flex on who's going to have the lion's share of the load. Like, this one's going to be really heavy on Ruby. But
Yeah.
like health education and promotion, I mean, I could take a big chunk of that one. And Emily could probably be a big help with disease prevention and control in conjunction with Ruby. There's like stuff that's going to be better for
Okay.
each of us to tackle.
I feel really good that I helped contribute the mission statement, because that might be a contribution. Okay. So I'll revise the scope document, so we all have what our scope is. We have to vote on that, obviously, but then next meeting we will, the October meeting, we're going to look at your public health policies. And
Actually, put emergency plans, because it's not necessarily my policies, it's my plans.
public health emergency plans.
Yes.
Okay. And first scope item. Okay.
Are we going to do that at the working meeting too?
We can.
Okay.
I mean, we can talk about it a little bit. It can be secondary, but we can kind of finalize. It's just so much gets lost in 2 months. I mean,
Oh, yeah.
there's so much gets lost. So yeah, so it's nice to like, okay, let's touch base. What are we focusing on next month? And kind of make sure we have what we need. Okay.
I like your idea. It's the playbook. And put that together. So
Yeah, that's a really, really good way to put it.
yeah.
Okay, so I will get that playbook. Okay. All right. Let's see. And then updates for agendas. We had talked about that. That kind of fell off of this agenda, which is okay. We can discuss that on the 17th. If we want, we can discuss it briefly at the working meeting, depending on if we have time or want to discuss it.
LAPC meeting's coming up too, so we
Yeah.
could touch with them with DES maybe at the same time. Just
Yes. Let's do that. Yes. So, yeah, as far as agendas, like my thought was we can talk about what we want to see on our agenda. Like, we already have Ruby and Megan, and what it might change seasonally. We might want to have
Well,
somebody
we
come
might want
in
to
and
have
talk.
like DES
exactly.
have a standing spot on there too.
Yeah,
Yeah.
so we'll do that. Make sure that's on there. Okay.
Who is our DES?
Aaron Reynolds has kind of stepped up to fill that position when Brittany left.
Okay.
So he's kind of jumped in and filled it, and he's kind of in between sheriff stuff and DES. So it's looking a little different. We're kind of we're figuring it out.
Is it
As
planning
we go.
on staying that way, or are we, with Aaron doing both, or are we gonna hire a new DES? Because at first it sounded like he was just gonna be interim until we could hire someone new.
There's more to it.
Okay.
That because of stuff that it's like
Yeah, yeah.
personnel stuff I can't talk about.
Okay.
But yeah, there's more to it.
Okay.
But yes, we'll
Yeah.
talk more about it.
No worries.
Yeah. Okay, we need a vote, you guys, on
On the scope?
the scope, on those five scope items.
Can we just say changes as discussed, or do we have to point out each one?
Yep.
I move that we accept the scope of the Board of Health with changes as discussed.
I'll second.
Okay, there's been a motion and a second to adopt the scope with the changes as discussed. Is there any public comment? Any public comment? Okay, hearing none, all those in favor, please signify by saying aye. Aye. All those opposed, same sign. Motion passes. Sorry, Emily, you were like delayed for a second. Okay, let's see. All right, so we got strategic plan. We'll start that as we move forward. Next on the agenda was just the county website, Board of Health page, new information. This was also in our previous discussions, was just what could we be putting on the Board of Health website. So the county website is pretty like it's great. It's a lot more functional than the old one, but it's pretty, you know how they have the formats. Like you go in to log in and do any admin, and it's very, the text boxes are there, like everything's there. But you could do a flyer. We could put informational stuff. I mean, we could do a pretty looking flyer that had information and
Just
put
it
that in
in
there. We can kind of move where contact information is a little bit. There's definitely some things we can do. I know we had discussed, adding the mission statement, which we now have to put on there, which I think is good. Then doing seasonal updates, health resources like public health, environmental health, the difference between the two, whatnot. So I think Daleen and I will probably have to do the management of that since she's our board admin. But the board would need to say, hey, I've got this item I want to put on the website.
Well, and that kind of would fall into our strategic planning too, because that's part of what we were looking at, like how we would want to manage our website. So we might have to wait before we put anything.
Would that be under the health education and promotion?
Yes.
Okay. So we'll just write website. I'm going to write website. I'm just going to make a note of website under here.
Mm-hmm.
Are you guys all okay if I put like the Board of Health mission statement on there now?
On the
not
front of
urgent.
this, it says it has to be approved by the commission.
Oh, that's right. Oh, thanks. Thanks for reading my own notes.
Mhm.
I appreciate that.
So once we get it approved by the commission, yes.
Okay, so we need mission statement approved by commission.
The scope also, or just the mission?
Why don't we have the scope? Is that okay, Dwight? You good with that? Mission statement and scope?
Yeah. One of the things with the website is keeping it up to date. Maybe at each meeting, if there's something that we see that we talked about, we could add that to the.
Yeah. Like
I'm
a
sure
news,
how the-
like a news section.
Yeah, I don't
Kind
know
of,
how a tickler to put something in there.
We could start the meeting 10 minutes early for us, if everybody could do that, and we could just review the website 10 minutes before the meeting.
I mean, we can, or everybody can just review it and come
Yeah.
back. There's nothing, the only thing that's on the Board of
There's
Health
nothing on there.
page is just the contact information. That is all that
Yeah.
is on there.
That's
So
true.
I can link, I know I talked to Ken about this. We can, like I said, we could post, like, I think a flyer would come up as a picture, right?
Yeah, it
So
should.
you could have like a flyer done however we want with the stuff on it. And then like maybe there's an area for things like news, right? Things that are changing. We could just do a header. I find all that a lot more important than like the contact information, which right now is front and center.
Which is all we have.
Yeah. You know, we could have our mission statement at the top. Just I can talk to Ken about that.
Well, and I think when we get the mission statement and the scope approved and updated, we should put both of those on there. Like, so if someone happens to go to Board of Health, they can, because by then we should be advertising another board position.
Yes.
So we probably should have that stuff on there easily accessible so people can read it and figure out if they want to be part of those.
That's where
options.
that's going to be advertised. Board members are going to be advertised, or board openings will be advertised October 1st. So that'll be quick, but we can, yeah, we'll get it there. We'll get there. I think I'm just trying to think. Let's get the mission statement and the scope to the commission. Get that approved. I can put some stuff on the website that way, and then as we move forward, we can just figure out how we want to add things and what looks good. You know, I could even play with it a little bit and do some, you know, like try a flyer and just see what it looks like as a picture, right?
I can get you a flyer on the new car seat law. That'd be something good to put on.
Totally, and that's okay. I mean, that's an easy thing to do.
I mean, it's a law change. It's good for everybody to know.
Yeah, that would work. Is there anything else, Emily? Dwight, do you guys have anything else on the website?
No, I think that sounds great.
Okay.
To get the
Good
mission
start.
and
Good start.
scope at some point.
Okay. All right. So for the next agenda, we've got bylaws review. It's just hard. You don't want to pack too much into each agenda, right? I think bylaws review was something that was suggested, Emily and Tiffany, when we were at the Board of Health Confluence. They were saying, look at your bylaws. I'm okay with just kind of kicking that to the new year.
That sounds good.
Is that okay? We can make that like a new year.
Maybe even longer. Let's get the plan.
Yeah. We'll talk about the additions to the agenda. We said next time. I'd looked up some stuff, and I couldn't remember why we were talking about this, but the Public Health Service Act, the 330A Public Health Service Act, I had looked up a bunch of information on it, and you don't have anything on it, you guys. I'm sorry, this because I just threw it onto new business since I wasn't sure what we would even be talking about. But that maybe is for the future. It's 330A, and I just had gone on AI and asked about it, and it gave me a bunch of information. It's in particular to expand access to care in underserved rural areas. So maybe look at that, and we could put that on there somewhere. And then funding programs, which is something else I had looked into in my when we were going to meet previously. I had pulled a bunch of funding programs, information on funding programs for rural health stuff. So that's for next time. New business for next agenda. Are there any other comments, any other thoughts that we need to add or put on here?
The hospital's going to do the Great Shakeout Drill, which is an earthquake drill across the country on 10/10 at 10/10. We're going to do an evac of the hospital.
Evac of the hospital for the earthquake drill.
Mm-hmm.
Oh, with all the patients and stuff. Oh my gosh, you guys. Okay.
You're
All right.
welcome to come and watch.
Wow.
Or help.
Okay. Or help, yeah.
Do you need assistance?
Or help, yeah. Dwight, do you have anything?
Well, I don't know if you've seen the news, Billings Health Department, which is overseen by the Yellowstone Health Department, I believe. Is that right, Ruby? You know.
The Billings Health Department is kind of a weird thing. It's in the conglomerate of I think it's Riverstone Health is what they
Oh,
call
who's-
themselves.
Well, I don't know if you've seen the news here lately. This morning, it was a big topic. Is they're taking on these sports, not sports drinks. These little bottles, these drinks. What do you call them? Energy drinks.
The 5-hour energies?
Yeah,
Yeah. Yeah.
And they're going to disband them in Yellowstone County. And it's been the hot topic there. As the health department's taking it on because they're addictive, and I think we'll see a big deal with that here in the next few weeks. So it's just something to kind of. I was
Interesting.
going to ask
Okay.
Megan about that and see
Interesting.
what she thought about it. It was on this morning's news.
So they just
too.
like wouldn't have them available and
Yeah,
they wouldn't
they're
allow
ta-
to be sold in the county.
They're not. Yeah, they're not approved by the FDA. So I just wonder how it's going to go. But yeah,
Yeah. I'll
yeah,
have to look into that. I haven't seen anything on
yeah.
it, but I also.
I just saw it the last couple of days. So
There was
Supplement,
another
so it doesn't
one.
have to be regulated.
No.
yeah.
There was another one, also not regulated by the FDA, now that you're saying that, and I'm going to butcher the name of this. There's a number with the name. It's similar. It's not as bad as, oh my gosh, not meth. What's the other one that's killing everybody? Oh my gosh.
Heroin?
Fentanyl, thank you.
Oh.
Holy cow.
Yeah.
It's not as bad, but it has similarities, and there is.
Xylene?
I don't know, but it was not. It was like H770 or something like that is what it's actually called, and there's a plant or actual herbal that you
Oh.
can get, but then what's happening is it's
Kratom.
is it kratom? Maybe it's kratom.
Yeah, that's it.
That's it.
That's
It's
it.
kratom.
That's
It's
the
kratom.
one that the.
And you can go to, yeah, you can go, it's kratom. And
Yeah,
you
it
can
is.
go, okay, so it's the
It
same
is.
thing.
It's
We're talking about the
kratom.
same
Thank
Yeah,
thing.
you.
they sell it at like smoke shops. And
Yeah,
everything.
yeah, and
It's
you can
kratom.
stop by and buy it, and then it says it's from the natural
Yeah.
source,
Yeah,
but
it
it's
is
not.
kratom.
It's
It
totally
works the same
synthetic.
as an opioid and can cause.
Yes.
Yeah, it is kratom.
The
That's
same.
Kratom.
that's the one
Thank
that
you.
they're taking on
Yeah.
now. It's
Yeah,
It's addictive and dangerous and stuff. So
not a bad thing
Yeah.
to do.
Huh.
So I don't know.
Yeah,
It's not
just-
super safe.
yeah.
No, it's
This
not
is-
super
Because
safe.
it's also not regulated in any way, shape, or
You can go.
form, and so
Go ahead. Go
um,
ahead. Thank you.
dosing is not remotely
Yeah.
reasonable. Like you can
No.
get it in whatever dose you want. It varies in concentration from batch to batch because there's no quality testing. Like it's a helpful medication essentially is what people are using it for, but it's so unregulated and so sketch that it's just not even.
Yeah. That's,
Right,
That's,
and
that's it. That's
That's
one
what
of
it
the-
is. Okay,
yeah.
and they're claiming that it's false packaging basically because it's claiming on there that it's from the plant or whatever. I'm thinking,
It is a
think it's
plant derivative, but it's
Yeah.
there's no good way to regulate your dosing
Right,
essentially,
Right.
and so
but there's also synthetic. They're like
yeah.
they're mimicking the plant
Yes.
and then they're saying it's still from
It's
the plant when it's
it would
not.
be the same
and-
thing
yeah.
as like spice,
Yeah.
like the synthetic THC,
Oh,
like
okay.
same deal.
But it's a lot more harmful, I believe. It's a lot
Spice
worse.
is not good for you. That's the one
No.
that made people in Florida eat people's faces.
Oh, that was like the zombie one.
Bath
Wow.
salts is the other name for it.
Yeah, yeah.
Well, they were
okay.
saying it's highly addictive.
Oh, kratom is, yes,
yeah.
because it essentially goes into your body like an opioid, so your body becomes dependent on it like an opioid.
So
Wow.
if we're tracking that, if you're following that at all, I mean, if that's something we want to talk about doing, then we talk about doing it. I mean, I'm not big on.
I was just have it kind of have it on our radar or see what
Yeah.
else is happening around the state.
Yeah,
and
I'm
stuff.
curious.
Yeah.
Just because if it's getting banned left and right, there's
yeah, I
in
don't know.
Montana, there's
Yeah.
probably a fairly
Yeah.
good
Well, and I
reason
don't
for
know
it.
if Lewis and Clark, because that would be the closest supplier to
Yeah.
us would be Lewis and Clark, because
Yeah.
I don't think there's anywhere in town that would sell it.
But they sell it at gas stations. they
Yeah.
said.
Not here. They don't sell it at our gas stations.
Are you sure?
As far
Okay.
as I'm aware, yes.
Okay,
I can't
okay.
find it in our gas
Okay.
stations at least. Because I've seen what the bottles look like, what the drinks look like, and I have not seen them here.
Oh,
So I apologize to 5 Hour Energy.
Yep.
It is not 5 Hour Energy. Sorry. Like defame 5 Hour Energy. All right. Is there anything else, you guys? Emily, do you have anything else?
Nope, I think just ramping up for flu season and getting everything going for that.
Awesome.
Good deal.
Exciting.
Yep.
good
All
deal.
right. All right. We will
Get
adjourn.
better.
Next meeting, just reiterating, next meeting, what did I say? October 20th at 3 p.m.
Perfect.
Okay? All right, see you then. We are adjourned. I'm going to shut this off, otherwise it will continue to record.
changes.
I don't know why I couldn't shut my phone off. I don't, it's like,